Hi, everyone. Did you know that health anxiety has more to do with your thoughts than it has to do with your health itself? Health anxiety is driven and maintained by catastrophic interpretations of regular body sensations or overly negative perceptions of health-related information. So it's a bunch of unhelpful health-related thoughts that cause a person's health anxiety. And one way to help address unhelpful health-related thoughts is to challenge them head-on, remembering that our thoughts are not necessarily accurate representations of what's actually going on. They're just our thoughts. Sometimes our thoughts are accurate and true and valid. Other times, our thoughts are only partially correct. And a lot of the time, our thoughts are completely inaccurate and unrealistic interpretations of situations. So the only way to determine whether our thoughts are accurate, partially accurate, or completely inaccurate is to recognize the thoughts, examine them, and evaluate how true they actually are. One way of thinking about this is to imagine that you're in a courtroom and that you're putting some of your thoughts on trial. So in order to evaluate whether or not your thoughts are true, you need to collect evidence and make arguments for and against the truthfulness of the thought. And based on the evidence that you collect and that you present, you can then make a judgment on whether or not this thought is accurate and true. Now, this can be something that can be quite challenging if you're trying to do it in your head, as it's hard enough to keep track of one set of thoughts and so much more difficult to keep track of multiple different sets of thoughts, presenting different evidence and proof to support or discount the truthfulness of a thought. You can imagine how hard that would be to try and keep track of in your mind and how messy and confusing it could get. So the way around this is to work through a thought diary or a thought record, which allows you to write down and track your evaluation of these health-related thoughts. Essentially, what this thought record does is it allows you to get the various thoughts out of your head and organize them in a clear, succinct way that allows you to analyze the thoughts on a piece of paper. So the first thing to do is to recognize when you're experiencing an episode of health anxiety, when you have started worrying intensely about a particular aspect of your health, and to think about the context that this health anxiety worry is taking place in. So essentially, you're asking yourself, what was the trigger for this current health anxiety episode? So for example, I'm watching a news story on TV and there's a reference to prevalence rates of leukemia. And I notice that I've been feeling run down and tired over the last few weeks. Once you've identified the trigger and the context for this health anxiety episode, the next thing to ask yourself is, what is it that I'm worrying about? What are my health worries in this moment? You can also ask yourself, what is it that I'm predicting is going to happen in this situation? And what are the conclusions that my thoughts are going towards? Well, in the example, I might start worrying that I'm not just feeling run down and tired because I've been working a lot, but that this is an underlying sign of leukemia and that this is the start of my decline into death. I worry that I've been feeling tired and run down for a while, and even though I've talked to my doctor about it in the past, nothing has come up in any of the blood work that my doctor's done. But maybe my doctor hasn't ordered the right tests to identify whether or not I have leukemia. So the next step to ask yourself, once you've identified the thoughts and the thoughts that you're having in the situation, what you want to ask yourself is, how are you feeling in this situation? What are some of the emotions that are coming up? Are you scared? Are you angry? Are you sad? Or are you hopeless? What are some of the physical sensations that you're noticing? Are your muscles tense? Are you feeling lightheaded or even more tired or run down? In the example that we're talking about, I might find myself feeling really anxious, noticing that my heart's beating faster and feeling tension throughout my body. So now you have the situation or the trigger, you have some of the health anxiety thoughts that you're thinking about in this situation, and you've now recognized the physical and emotional impact that these thoughts in this situation are having on you. Now we have an opportunity to actually look at and examine and challenge how realistic, true, or accurate these thoughts actually are. So some questions to ask yourself is, what exactly is the evidence that supports my thoughts in this situation? What is the evidence that might demonstrate that my thoughts are not entirely true? Are there any other possible explanations for the physical sensations I'm experiencing? What is the worst case scenario here? And would I be able to cope even if that worst case scenario were to happen? What are the most realistic or likely explanations for what I'm currently experiencing? What can be done to cope with this situation or this physical sensation that I'm experiencing? So, in the example, the evidence that supports my thoughts in the situation are that I've been feeling tired, and I know that fatigue is a symptom of leukemia because I've looked it up on the internet. Well, what about the evidence that doesn't support the thought? Well, I've had previous tests by my doctor that haven't discovered anything suspicious. I don't have any family history of cancer. I've been very busy at work over the past few months, and maybe that's what could be wearing me down. Asking myself, are there any other possible explanations for the physical sensations? Well, as I've just noted, I've been really busy at work, and that has been wearing me down. I also haven't been eating particularly healthy recently. I've been under a lot of stress, which could also be contributing to how tired I feel. Well, what is the worst case scenario, and would I be able to cope even if it were to happen? Well, in this situation, the worst case scenario is that I would have leukemia, and I'd have to have treatment, which will likely involve chemotherapy and a bone marrow transplant. It's probably going to be very difficult to experience. It's going to be a very difficult experience to go through, but treatment options are available, and I know that I'll have the support from my family and friends to help me get through the best I can. What is the most realistic or likely explanation for what I'm currently experiencing? Well, the most realistic explanation, based on all of the information we have available, is that I'm probably feeling tired because I'm working a lot, I'm running myself down, and I'm feeling pretty stressed out, which all seem like more likely explanations for my fatigue rather than leukemia. So, what can I do to cope with the situation and manage the fatigue? Well, I can be looking at ways of improving my diet, getting to bed at a more reasonable hour, maybe looking at ways of getting more exercise, like going for nightly walks with my wife. Maybe I can also speak with my boss about getting some help for some of the projects that I'm working on and that are wearing me out. And so once I've gone through all of those steps, I've recognized the trigger, I've recognized my thoughts, I've recognized how I'm feeling, I've looked at the evidence for and against my health anxiety worries, I thought about other possible explanations and other ways of coping. By the time I've gone through all of that, I've taken this worry that might have been leukemia, and I've dissected it, examined it, and found that apart from me feeling tired recently, there isn't a lot to support that I'm going to die imminently from leukemia. And by thinking about it in this different way, my perception and my perspective is much different, and I'm much less likely to be anxious or fearful of the situation or fearful of the sensation of fatigue that I've been experiencing. So the way to use this information is that when you start to notice yourself starting to feel really anxious about your health, pull out a sheet of paper and work through these questions, writing down the answers, and try to come up with a realistic interpretation or a realistic evaluation of what's actually going on and how serious or dangerous it actually is. Now, it's important to point out that this is something that takes some practice. This is something we call cognitive therapy, and it's not something you pick up right away, in large part because we're not used to thinking about our thinking. So while it can feel a little unnatural at first, the more you do it, the more effective you become at recognizing, evaluating, and challenging these health anxiety worries. And the more you do this, the more it becomes second nature, and you can start to challenge those health anxiety worries in your head. Additionally, as you start to do more and more of these thought records, what you'll notice is that you may have the same unhelpful and distressing health-related worries come up again and again and again. And once you start to notice this, you can start to keep track of more realistic thoughts that you can think to challenge and counter those unrealistic and unhelpful health anxiety thoughts when they come up. This is almost like a bit of mental shorthand, and it allows you to come up with your conclusion automatically without having to go through the thought record process, because you've done a thought record to challenge this health thought and this health worry over and over and over and over again. And if you're interested in learning more about cognitive therapy and how cognitive therapy works to help reduce symptoms of anxiety and depression, I'd encourage you to check out this video. So that's all for today's video. As always, thank you for watching all the way to the end of the video, and I will see you in the next time.